Diagnosis, treatment and reporting of dementia is a massive and previously unrecognised scandal. Most cases of dementia could probably be cured in a week or two, maybe a bit longer with some patients. In my view, anyone who claims that dementia is always incurable is either woefully misinformed or else a drug company mouthpiece. We all know that governments lie, and that most branches of the mainstream media are propaganda vehicles, lazily reporting whatever nonsense they're fed. But drug companies, charities and lobbyists now often influence the medical establishment. I'm pretty much banned from all mainstream media, and I'm regularly lied about for the simple but terrible crime of telling the truth. Around the world, there are estimated to be around 50 million people suffering from dementia, though this figure is probably on the low side. 1/2 of all patients admitted to nursing homes are said to be suffering from dementia. Millions of patients who've been diagnosed with dementia are being looked after by their families. Many family members have had to abandon their jobs and their normal lives in order to find the necessary time to provide care for their loved ones. Millions of patients have been dumped in hospitals and nursing homes where they sit or lie waiting to die. The commonest diagnosis for all these patients is Alzheimer's disease. It's widely reputed that 2/3 of patients with dementia are suffering from Alzheimer's, which has in many countries become the default diagnosis. If a patient has dementia, then they'll be assumed to be suffering from Alzheimer's, and little or no effort will be made to find any other diagnosis. The drug companies, the big charities, the media, and even some doctors seem to promote the view that the words dementia and Alzheimer's are pretty well interchangeable. The prognosis for those diagnosed as suffering from Alzheimer's disease is a gloomy one, for despite many promises, there's still no cure for this disease, nor is there any sign of a cure on the horizon. Drug companies have produced a number of prescription-only drugs recommended for use with Alzheimer's patients, and alternative healthcare practitioners produce new remedies on an almost everyday basis. Despite all the promotion given to Alzheimer's disease, there is, however, clear evidence that many so-called dementia sufferers who've been diagnosed as having Alzheimer's disease have been misdiagnosed. They're suffering from something quite different and could be cured, often completely and frequently within weeks or even days. Some people believe that dementia is a normal part of the aging process, hence the term senile dementia, but it isn't. The word dementia is a general word for the symptoms displayed as a result of a number of different diseases, in much the same way that cancer and infection aren't specific diseases. When someone displays symptoms of dementia, it's the doctor's job to identify the underlying cause. Besides Alzheimer's, other disorders that can cause dementia include advanced syphilis, vitamin B12 deficiency, Huntington's disease, Down syndrome, Pick's disease, strokes, late multiple sclerosis, brain tumours, hormone deficiencies, chronic alcoholism, drug abuse of both illegal and prescription drugs, head injuries, and idiopathic normal pressure hydrocephalus, and a number of other conditions. Nearly half of all individuals with Parkinson's disease eventually develop dementia. Dementia can also occur in a condition called Creutzfeldt-Jakob disease and variant Creutzfeldt-Jakob disease. Dementia also sometimes occurs in the late stages of human immunodeficiency virus. And there's dementia pugilistica, also known as chronic progressive traumatic encephalopathy, which is a disorder which develops in people who've had repeated head injuries, boxers and football players, for example, and which produces symptoms similar to Parkinson's disease. And there's a condition known as vascular dementia. Quite a number of different types of dementia are treatable. So, for example, patients who've developed dementia as a result of having a treatable brain tumour, patients who are suffering from poisoning as a result of toxins such as lead or mercury, patients who have syphilis, Lyme disease and other infections, and patients who have myxedema may all recover when their conditions are treated. Patients who develop dementia after a sudden head injury may also make a good recovery. It is sloppy and unprofessional to make a diagnosis of Alzheimer's as a default diagnosis, and to claim that dementia is incurable is as absurd as saying that all patients with broken legs will never walk again, or that all patients with chest infections will die. It's cruel, manipulative scaremongering, and those who repeat this nonsense should be ashamed of themselves and their ignorance. Parkinson's disease can cause dementia, but drugs may help. Huntington's disease can cause dementia, and although it isn't curable, there are medicines available which may help reduce the severity of symptoms. Alcoholism can cause dementia, but as millions can confirm, it's a controllable disease. Then there's dementia caused by vascular disease. This affects millions around the world. And although there's no cure, there are drugs available which can slow down the progress of the disease. Many patients who are depressed show signs of dementia, which will disappear when the depression lifts. Patients who have normal pressure hydrocephalus show signs of dementia, but they can be permanently cured with a simple operation. Millions of patients appear demented because they've been overdosed with tranquilizers, sedatives, sleeping tablets. These patients can recover completely if their unnecessary medication is stopped or reduced. Although this must always be done under doctor's supervision, of course. And huge numbers of patients who have all the symptoms of dementia and who may have been given the default diagnosis of Alzheimer's will show a dramatic improvement in a couple of weeks if what they have wrong with them is undiagnosed vitamin B12 deficiency, treatable with simple injections of the missing vitamin. Through ignorance and laziness on the part of doctors, and a result of deliberate misinformation spread by a deadly combination of drug companies and specialist charities, millions of patients have been given a default diagnosis of Alzheimer's without proper investigations ever being conducted. The hidden underlying problem is that medical policy relating to the classification, diagnosis and treatment of dementia is defined and directed by drug companies, which have for some years controlled the medical establishment and which run medicine so that their own commercial interests are best served. And that means encouraging doctors to make diagnoses which are commercially advantageous, and then promoting and selling large quantities of drugs which are expensive and profitable but often largely useless. The cost to individuals and to the community at large is too large to measure. The emotional cost is phenomenal, and the blunt financial cost is horrifying and has to be measured in tens of billions. There's the cost of providing home or institutional care for patients requiring constant attention, and there's a cost of purchasing the largely useless pharmaceuticals sold by the greediest and most ruthless industry man has ever created. The result of the propaganda efforts of the pharmaceutical industry and the charities with which the industry is now linked is that there's no doubt that if you asked 1,000 people to name the commonest cause of dementia, at least 999 of them would say Alzheimer's disease. Indeed, most of the 1,000 would probably tell you that dementia is just another word for Alzheimer's and that the two are synonymously. Alarmingly, a similar result would probably be obtained if you asked 1,000 doctors to name the commonest cause of dementia. They would, of course, all be completely wrong. Alzheimer's disease is not the same thing as dementia. And Alzheimer's disease probably isn't even the commonest cause of dementia, as I've pointed out. These myths about dementia and Alzheimer's disease have not come into being by accident. On the contrary, they are the result of a very deliberate campaign of propaganda and misinformation. And the propaganda has been managed very deliberately and ruthlessly, and with absolutely no regard for the health of patients. The cheats have doubtless been helped by the fact that there's no test for Alzheimer's disease. The drug companies love diseases, especially chronic diseases, which cannot be proven because there's no specific reliable diagnostic test. The absence of a single reliable test has made it damnably easy for the drug companies and the charities to ensure that Alzheimer's is the default diagnosis. For purely commercial reasons, the drug companies and their chums, the big Alzheimer charities, are desperately keen to convince people that Alzheimer's and dementia are the same thing. It's in the interest of the drug companies to diagnose every case of dementia as Alzheimer's disease. Drug companies don't want patients to be diagnosed with disorders such as vitamin B12 deficiency or with normal pressure hydrocephalus because they won't make money out of those patients. It is, of course, all about the money. There are a number of drugs on the market for the treatment of Alzheimer's disease. These drugs are expensive, and in my view they do little or no good, and they certainly don't cure patients. But obviously drug company profits will rise as the number of patients being treated rises. Drug companies favour Alzheimer's disease for very simple reasons. First, Alzheimer's disease tends to be chronic. It lasts for years. The drug companies love chronic diseases. Providing pills for patients who need medication for years is far more profitable than providing pills for a 1 or 2 week course. Second, most of the other major causes of dementia don't need expensive drugs. Patients who've got the symptoms of dementia because they're short of vitamin B12 can be treated with very inexpensive injections of vitamin B12. Patients who appear demented because they're being heavily dosed with tranquilizers or sleeping tablets will recover if their drugs are reduced or stopped under medical supervision. And patients who've got normal pressure hydrocephalus can be cured with a very simple and cheap operation which requires virtually no input from the pharmaceutical industry, leaving absolutely no chance for profits for the drug companies. So how big is this scandal? How many patients are involved? How many patients are currently sitting or lying in nursing homes, care homes, hospitals, or the spare rooms of hard-pressed relatives because they've been misdiagnosed as suffering from Alzheimer's disease, when in reality they could be treated? Officially, the figures show that around 2/3 of dementia cases are caused by Alzheimer's. That is, without a doubt, a massive exaggeration. My professional estimate is that at least half of the patients diagnosed as having Alzheimer's are actually suffering from something quite different, with the prescription drug confusion, vitamin B12 and normal pressure hydrocephalus being the 3 top diagnoses which are missed. It's difficult to think of a bigger scandal in modern medicine. Alzheimer's should be the very last diagnosis made when a patient is showing signs of dementia. It should not be the first diagnosis, and it should never be the default diagnosis. I believe that anyone with dementia should be properly investigated for vitamin B12 deficiency or normal pressure hydrocephalus because, apart from dementia and confusion caused by prescription drugs, they're the commonest causes of dementia which are easily and permanently curable. If the patient is shown not to have normal pressure hydrocephalus or vitamin B12 deficiency, and they're not taking regular doses of tranquilizers, sedatives and sleeping tablets, then and only then should doctors investigate the possibility that they might have Alzheimer's. If you want to know more, just take a look at my website where there are some relevant articles quite free, or read my book Dementia Myth, which contains a good deal of detailed information. Far too much to include on this tape. I'm planning a lot more videos for YouTube to expose medical scandals. If you want to watch them, then please subscribe. Thank you for watching. Take care of each other.